A cold is a virus that affects your upper respiratory tract, which includes your nose and throat. Colds usually last less than a week and are caused by different types of viruses. Adults get about 2 to 3 colds each year, and kids tend to get even more. What causes the common cold? Over 200 different viruses can cause a cold, with rhinoviruses being the most common. These viruses are highly contagious and can spread through the air, close contact with others, or by touching surfaces with the virus on them and then touching your eyes, mouth, or nose. For example, you could catch a cold by shaking hands with someone who is sick. Cold symptoms usually hit their peak within 2 to 3 days after you're infected and may include runny nose or stuffy nose, coughing, sneezing, sore throat, headache, mild body aches, low-grade fever, more common in older kids and adults. The stages of cold. What to expect. Stage 1. Incubation. This is the time between getting infected and showing symptoms. You won't feel sick yet, but the virus is getting ready to make its move. For most colds, symptoms can start in as little as 24 hours. Stage 2. Early symptoms. This stage lasts about 1 to 3 days. It often starts with a scratchy throat, followed by a sore throat, runny nose, fatigue, sneezing, and congestion. You're contagious during this time, so be sure to stay home, cover coughs and sneezes, and wash your hands often. Stage 3. Peak symptoms. From days 4 to 7, your immune system is in full battle mode. Symptoms like body aches, coughing, hoarseness, and congestion hit their peak. Rest is key. Use over-the-counter meds like Tylenol to manage fever, but seek medical help if your fever is above 105 degrees Fahrenheit or lasts more than 48 to 72 hours. What happens in your body? When you catch a cold. When you catch a cold, the virus attaches to cells in your nose, particularly in the nasal passages and sinuses. These cells then start replicating the virus. It takes about 2 days for your immune system to notice and respond. Your body reacts by expanding blood vessels, which causes stuffiness, and releasing chemicals to fight the virus, leading to inflammation, a runny nose, and coughing. The symptoms are actually signs of your body fighting the virus, not damage from the virus itself. As your immune system battles the virus, it creates antibodies that help destroy it. After recovery, these antibodies remain, ready to fight if the same virus returns. However, with over 200 different cold viruses, you're likely to catch different ones multiple times each year. How long does a cold last? A common cold usually goes away in less than a week, but how long it lasts depends on factors like your age, overall health, and the specific virus causing the cold. While there's no cure for the common cold, various home remedies and over-the-counter medications can help ease the symptoms. Risk factors for the common cold. Certain factors can increase your chances of catching a cold, including time of year. While colds can happen year-round, they're more common in the winter or during rainy seasons. We tend to stay indoors more when it's cold or wet, making it easier for the virus to spread. Age. Children under 6 years old are more prone to colds, especially if they attend daycare or are around other kids. Environment. Being in crowded places like airplanes or concerts increases your likelihood of coming into contact with cold viruses. Weakened immune system. If you have a chronic illness or have recently been sick, your immune system might be weaker, making you more likely to catch a cold. Smoking. Smokers are at a higher risk of getting colds, and their symptoms tend to be more severe. Lack of sleep. Not getting enough sleep can weaken your immune system, making it easier for cold viruses to take hold. Why do children and babies get more colds? Children and babies catch more colds because their immune systems are still learning to recognize and fight new viruses. Unlike adults who have been exposed to many different viruses over the years, young children are encountering these germs for the first time. Before they turn 2, babies can get as many as 8 to 10 colds a year. As you get older, your immune system becomes better at identifying and attacking similar viruses, so adults typically get fewer colds. Children are also often in close contact with other kids, who might not cover their coughs and sneezes or wash their hands before touching their faces. This makes it easier for colds to spread. Cold viruses can live on objects for hours. and babies often pick up things that other children have touched. If a baby touches something with cold germs on it and then touches their mouth, eyes, or nose, they can catch the virus. How are common colds in babies treated? When your baby has a cold, avoid giving them any over-the-counter cough or cold medicines unless their doctor says it's okay. Here's what you can do. Keep them comfortable. Make sure your baby is cozy and well-rested. Give them fluids. If your baby is 6 months or younger, offer breast milk, chest milk, or formula. Once they are 6 months old, you can also give them a little water. Since most babies can't blow their nose until they're about 4 years old, you can help clear their stuffy nose with these methods. Saline and suction. About 15 minutes before feeding, use saline, salt water drops to loosen the mucus in your baby's nose. Then, use a rubber bulb or suction device to gently remove the mucus. This will help your baby breathe easier while feeding. Petroleum jelly. Apply a little petroleum jelly around the outside of your baby's nostrils to prevent irritation. Be careful not to block the inside of their nostrils. Avoid using nasal sprays unless your doctor recommends them. Humidifier or vaporizer. Use a humidifier or vaporizer in your baby's room to add moisture to the air. This can help ease dryness in their nose and throat. Make sure to clean the device thoroughly before use to avoid bacteria or mold. Steam. If you don't have a humidifier, you can take your baby into a steamy bathroom. Run hot water and sit with your baby in the steam for about 15 minutes. A warm bath can also help. If your baby seems well enough, they can continue their normal activities. However, if they have a fever or complications, it's best to keep them at home. How can colds in babies be prevented? To prevent your baby from catching a cold, try to keep them away from people who are sick. If you can, keep your baby at home. A virus that may only cause a mild illness in older kids or adults can be more serious for a baby. Hand washing is crucial for stopping the spread of colds. Adults who are around babies and young children should wash their hands after coughing, sneezing, or coming into contact with someone who has a cold. After wiping your baby's nose, wash both your hands and your baby's hands. Regularly clean toys and avoid sharing toys that babies put in their mouths. If soap and water aren't available, use hand wipes or sanitizers. How to treat a cold at home for adults? You can usually take care of a cold on your own without needing to see a doctor. Here are some simple steps to help you feel better faster. Rest. Make sure you get plenty of sleep. Stay hydrated. Drink lots of fluids like water to prevent dehydration. Eat healthy. Even if you don't feel like eating, try to eat nutritious food. It's common for young children to lose their appetite for a few days. Soothe your throat. Gargle with salt water, not suitable for children, or drink a hot lemon and honey drink to relieve a sore throat. Ease a stuffy nose. Inhale steam or sit in a steamy bathroom with a hot shower running. Home remedies. Home remedies won't cure a cold, but they can help reduce the severity of your symptoms. Use VapoRub. Applying VapoRub can open up your airways and reduce congestion. Zinc lozenges, a supplement which may shorten the duration of cold symptoms if taken early. Echinacea. It is a herbal supplement, also known as calamega. Some research suggests that it might help reduce the length of a cold. What to eat when you have a cold? When you're sick, you might not feel like eating, but it's important to give your body the energy it needs. Here are some foods that can help with recovery. Chicken noodle soup. This classic comfort food can help open up your sinuses and soothe your throat with its warm, salty broth. Hot tea. Warm drinks like tea can ease congestion. Add honey for an extra boost against a cough, and ginger to reduce inflammation. Avoid coffee, as caffeine can dehydrate you and interfere with some medications. Yogurt. Yogurt contains healthy bacteria that support your gut health, which may help your body fight off illness. How can colds be prevented in adults? Wash your hands. Frequently wash your hands, especially before eating or cooking, after using the bathroom, blowing your nose, or touching someone with a cold. Avoid touching your face. Cold viruses can enter your body through your eyes, nose, or mouth from your hands. Avoid close contact. Don't kiss, shake hands, or share cups with someone who is sick, and do the same if you're sick. Cover coughs and sneezes. Use a tissue to cover your mouth and nose, then throw it away and wash your hands. Clean frequently used surfaces. Wipe down doorknobs and other commonly touched items as viruses can live on these surfaces. Use hand sanitizers. If you can't wash your hands with soap and water, use an alcohol-based hand sanitizer. Strengthen your immune system. Get enough sleep, eat healthy foods, and exercise to help your body fight off germs. Stay at home when sick. To avoid spreading the cold to others, stay at home if you're not feeling well. Thank you for watching our video, and please subscribe to our channel to get more health-related updates.